Today, we complain about things like traffic, slow Wi-Fi, the DMV, the algorithm not pushing our content. But imagine living in a world where simply surviving childhood wasn't guaranteed. People didn't ask if cholera was coming. They asked whose house was it going to visit next. Typhus, cholera, tuberculosis, dysentery. Disease wasn't unusual. Death wasn't unusual. But making it to adulthood was. The part that stands out so much to me is that people actually believed that disease and death was a curse, or that getting disease was just a part of life and to expect it. Now, I want you to close your eyes. Imagine opening your front door. The streets are muddy, except it isn't just mud. Open drains run beside the road. Waste collects in cesspools beneath the homes. Some families literally slept above pits filled with human waste. The smell? Well, people described it as unbearable. Today, we would call it a public health emergency. Back then, it was just a Tuesday. And then a man came around and he started asking all the right questions. What if people weren't cursed? What if they weren't just unlucky? What if their environment was killing them? Meet Edwin Chadwick. He wasn't a physician, nor was he discovering something under a microscope. Chadwick was a revolutionary for his time. He followed the evidence. He interviewed the physicians. He talked to the engineer, met with the local officials. He reviewed death records. He inspected neighborhoods. He compared one town to another. He walked the streets where people were dying. And slowly a pattern emerged. Disease wasn't random. It followed poverty. It followed overcrowding. It followed standing water. It followed overflowing cesspools. It followed contaminated drinking water. Entire neighborhoods weren't dying because they were unlucky. They were dying because the conditions they were forced to live in. One of Chadwick's most powerful ideas was that disease had removable causes. Think about that for a second. Removable, not inevitable, preventable. That idea changed everything.